So welcome everybody to this week's episode for the Financial Freedom for Physicians podcast. And as you know, we tout 4 different types of freedom. First is financial, second is time, third is location, and fourth is emotional. And I bring on physicians who are entrepreneurs, investors, and who are doing things that are cutting edge and bringing awareness to our culture of medicine and trying to change the face of healthcare. So today we have Dr. Johnny Luo, really fascinating individual, which you'll hear about later. He's in the field of healthcare startups, and I'm going to bring up his bio here. So Dr. Johnny Luo is the CEO of Doctors Choice USA, and he is passionate about improving healthcare through helping individuals live healthier lives. Dr. Johnny Luo is the founder of Doctor's Choice, a company with a mission to provide clear and concise education to employers and retirees about Medicare. So you're going to hear all about the challenges with the healthcare system and the solutions that Johnny is bringing to these pain points. He is the author of The Retiree's Guide to Medicare, What Your Insurance Company Does Not Want You to Know, as well as author of over 15 peer-reviewed medical articles on regenerative health. He graduated from Brown University and as well as the Alpert Medical School at Brown University. So without much ado, welcome Dr. Johnny Luo. Welcome.
Thank you.
Yeah,
Dr. Christopher Luo. We could be related.
Yeah, I know Asian last name could be changed, and so depending on where you're from. But yeah, and it's great to have you on the show. I know both of ours we both follow the Tony Robbins community, and we're both Tony Robbins fan. And and I'm really interested in hearing your story because I'd like to find doctors out there who are not doing the traditional patient care activities. I want to find doctors that are really doing innovative things, different things that are changing the face of healthcare. So tell us all about your story, how you got started, and how you founded Doctor's Choice USA.
Sure. And again, Chris, I go on tangents, so correct me if I end up going on one and it's not helpful to your audience.
Sure.
Again, thanks so much for having me on. I really appreciate this opportunity. It's always fun to know when we connected. I was like, this guy knows what he's talking about when it comes to investing and retiring at 38. So really impressive. I hope to be there in a couple of years when I'm that age. So yeah, so a little bit about my background and story. I grew up in China, in Fuzhou, and I came to the US when I was 8 years old, and my parents were both physicians and professors, and they had established their career in Rhode Island, right? The smallest state, unless I think Washington, DC, if that becomes a state, then it'll no longer be the smallest state. So lived in Rhode Island my whole life. I went to school there. I went to medical school there, and I was in the process of going into primary care because I really liked patient care. I really liked helping people. I know that sounds cliche, but I guess everybody says that, right? If you have a kid that says, I want to go up to hurt somebody, I mean, their problem was probably bigger than getting into medical school. Yeah. So what was really interesting was when I was going through school, and I think this is the part of the story where last time we talked, I didn't really go into too much, and it was one of the spurring factors in what I'm doing today and the direction that I took. So I ended up getting sick in my freshman year in college, and it was some type of autoimmune disease. They really couldn't figure out what it really was. Part of it was exacerbated by nickel allergy. So that's actually one of the published papers. Was I realized that your cell phone could give you a nickel allergy, and that could end up in some pretty bad rashes. And so, long story short, there was I went through a lot of therapy as a patient. Learned a lot about dermatology. My dermatologist was at my weddings, good friend of mine, and he ended up giving me a lot of steroids and creams that helped me temporarily. But the downside of using a lot of steroids is that you've got weight gain, you've got acne, which is not a fun thing when you're 18 years old and you're trying to go out to parties. And what ended up helping me was Eastern medicine. I took about 2 years of herbal remedies and acupuncture and all these other modalities, and I ended up getting better. So they really couldn't figure out what type of sort of immune response I had, although I might be allergic to one or two things, but it was beyond that. And that's when I thought, geez, there's a lot of things that we need to understand more in healthcare. And that's why I decided to go through, because I was really interested in business. And that's why I decided to go through medical school. And because I wanted to learn more about the field, learn about patient care. How do you bring through new therapies? And what's the process of going from the bench to the clinic? And what I quickly realized was I was pretty disenfranchised by the system. I worked with great people, no complaints there. And during my clerkships, I started asking a lot of my preceptors, and I said, look, are you happy? And they're like, why are you asking that question? Like, pay attention. So after asking that enough, it came to be that 9 out of 10 said, no, I'm not happy. And it was really interesting because you saw these trends, right, where the primary care docs wanted to do something maybe NGO or nonprofit. A lot of this, I'm generalizing, and I apologize for doing so, but it's what I saw. A lot of the specialists, especially the surgeons, either were really engineering focused or they want to make a lot of money. So they would have, a lot of the specialists said, well, I wish I went on Wall Street or did consulting or something like that.
Yeah.
And it was really interesting to see the patterns. And I started to look at, why is that? And I started talking to more patients, because when you're a student, you can do that. And there's not a whole lot of, as long as you don't hurt anybody, you can have a lot of freedom to explore and ask questions. And what I ended up realizing was with medicine, it's a marketplace. At the end of the day, it's an exchange between patients that need the service and providers that can provide the service, hence providers. And neither side were happy with the experience. And that led me to think, look, there's got to be something wrong with this exchange, because let's say you go into a hot dog stand, right? And you're getting a hot dog, and the guys that's selling the hot dog to you is not happy selling you the hot dog, and you're not happy buying the hot dog. So theoretically, that hot dog stand should not exist.
Exactly.
So that's what's happening in medicine. And medicine is just ballooning. We're close to 20% of our GDP versus Singapore's 5%, other countries, 10 to 15%. And our outcomes are not much better. And we've heard those statistics over and over again. And I just thought, look, what am I missing here? And why is it so hard to innovate? And the definition of innovation, you ask 5 people, you get 10 different answers. And for me, it's about how do we just find a better way to meet our clients or our patients' needs. So originally the thought was, I'll finish medical school, finish residency, I'll join this practice. It was about 4,000 patients, 2 docs, 2 urgent cares, and maybe figure out a micro practice, concierge care, somewhere where we could develop a experience for patients that they wanted to experience, and also develop a lifestyle for doctors where you weren't working, 70, 80 hours a week and seeing your pay go down every single year. That plan didn't really pan out because I just felt like I wasn't getting any younger, and I knew that I probably wouldn't have been able to work. I had a good friend of mine who told me, look, he was at that point, he was 65 years old. And he said, look, I spent the best 20 years of my life, not, best 20 years, meaning the time of my life between I would say my late 20s to late 40s, where I could really work, right? I could work 70, 80, 90 hours a week on something I'm passionate about and still keep going. Versus he goes, I'm 65 now and I can't. I just energetically, I can't. Maybe we got to get him into some programs, but so that really struck me, and I was like, shoot, back then I was 24, 25. And I said, I got these 20 years to work really, really hard. Let's make it count. So that's when I said, look, what can I do immediately? How do I understand the healthcare system? Because even though I was a medical student and I had done a little bit of work at a local, very small biotech venture capital firm, done some medical research, but I really feel like I didn't understand how the pieces work together, like who's actually moving those pieces. Because every time you're a small player, you go out there and you have to exert a lot of energy. It's like riding a tricycle. You have to get somewhere. And the realization was, I need to learn more. I need to learn more about, if I'm going to bring new treatments to market, all of that, I need to first understand how things work, and then I can make some changes. Because otherwise I'm just a bull in a china shop. I don't really understand what's going on. And this is right around the time that the Affordable Care Act was coming out, so Obamacare. And I was still doing a lot of work in the same primary care office. And a lot of the patients that were coming into the office, they were older, they were on Medicare. So Medicare is for people that are 65 or older, or people who are disabled. And they were really confused. They didn't know what to do because there's a lot of communication on, the Obamacare. You got to do this. They plowed, I think, $100 million a state or something like that into
Yeah.
developing the systems and marketing. So it was everywhere, and people were really confused. And that was an independent system from Medicare in terms of how the patient experienced it. So patients were really confused. I didn't really have a good resource to send them to because I didn't know anything about insurance.
Uh-huh.
But I quickly realized that insurance was one of the hidden forces. I mean, insurance and pharmaceutical companies are some of the biggest forces, aside from these now big hospital chains, that are driving a lot of the decisions in healthcare, because centralized demand and centralized supply, and I needed to understand how all those big pieces worked. And
Mhm.
I'd done some pharmaceutical research. I wasn't a big fan of that because even though we've got some really great life-saving therapies, I also feel like a lot of times we can be over. Frankly, I don't know if it was your experience. I felt like I just went to medical school to be taught how to prescribe medications.
Mhm. Yeah,
And you
we're
do a couple surgeries here and there, which is fun. You did a lot more surgeries. So I I was really interested in insurance because I felt like insurance was one of the hidden well, it's not so hidden, but it's one of the big forces that if you get, I feel like this is my thinking at the time. If you get big enough in insurance, you'll be able to make a difference, because then nobody can come in and take you out really quickly, right?
Mhm.
Because nowadays, I mean, we're seeing this nowadays too, where it's like you say something a little bit that's off the fringe, you might get canceled. So
Yeah.
I figured if you have a really big insurance company behind you and you're trying to do the right thing, then you're gonna have a lot more momentum. That was my thought.
Uh-huh.
Whether or not that's true, I don't know. We still have to wait for it to pan out. So I said, what can I do to add value immediately? Because even though I had a little bit of tiny bit of experience as an intern, worked a little bit at a venture capital firm, I still didn't understand the breadth of how do you start a company? How do you go out there and either raise money or scale up or all of that? And I know that a lot of my colleagues were thinking the same thing. They were thinking it'd be really cool. They all had an idea. Everybody had an idea, and ideas are cheap. Like,
Mhm.
I have this great idea to do this, and I think it'd be great. How, I want to sell you the idea for 50% of the company or something like that.
Yeah.
And quickly realize it's not about the idea, it's about execution. Two people can have, oftentimes multiple people have the same idea. It's who can execute it better. So for me, immediately, I didn't really have an idea, but I did have this problem, which is a lot of patients that were confused about their health insurance, and I wasn't equipped as a provider to be able to educate them when I should be.
Mhm.
And hence, that's when Doctor's Choice was started. Hence, doctors helping patients make smarter choices. That was
Mhm.
the etiology of the name. But what it quickly grew into was it was taking a lot of education around what Medicare means and how to navigate Medicare. It was about 100 hours of research distilled down into about a 40-minute presentation. Initially, it was to teach doctors how to better talk to their patients about health insurance. That was a disaster because people were like, you're gonna get sued for Stark Law. You're gonna have all these, doctors, they're not getting paid for it. There's gonna be all
Mhm.
these issues. Who's gonna spend the time to do it? So I said, okay, that's fine. That's not a good path. But then patients really wanted the education. And then we quickly realized that most people get their health insurance from employers,
Mhm.
and employers they were really the right venue. Employers and some essence doctors nowadays, because now they've gotten a lot intertwined with the insurance programs and the risk sharing and all of that. But back then it was employers provided health insurance. Employers had an aging workforce. 1 in 4 Americans are going to work past 65. The
Uh-huh.
number one concern in retirement is, am I going to have a catastrophic issue that's going to wipe me out financially from a healthcare perspective? Because we hear all these scary statistics. Somebody saved for their whole lifetime, and then some health issue happens, and then they have to spend hundreds of thousands of dollars on care and so forth. So people are really scared about that.
Yeah.
So that's the number one concern. And people were a lot of times delaying retirement because of that reason, because just there was a lack of information. There was a lack of clarity, and there's lack of
Uh-huh.
concise guidance. And most of what was out there was a lot of people trying to just simply sell insurance. And
Right.
nothing wrong with that, but just not the approach that I wanted to take, not the approach that I wanted to send my family towards, and definitely not my patients. So I wasn't comfortable sending patients to, a sales presentation where they're going to be sold something. So
Yeah.
what we decided to do was, at the company, we built a platform which the process of going from employer insurance to Medicare is incredibly cumbersome, because not only do you have to go on the new insurance, you've got to navigate through your human resource department. You've got to go through the federal government, which we know it's always a breeze, right? When you have to go to the federal government for something. And then you've got to sort through over 2,000 different plan combinations across the country. It's probably a lot more than that.
Yeah.
But a lot of insurance options. And the good thing is that it can be hyper tailored. An option can be hyper tailored to somebody's doctors, medications, lifestyle, all that. The downside is too many options to choose from. I mean, I go to a restaurant, I get confused because there's too many options in most restaurants. So same thing with the consumer, and they're making really, in some cases, a permanent decision. So we wanted to have a better way of doing that, and that was really the need that we were meeting. And the benefits, we wanted to set up a win-win-win situation. So the win for the individual was they would get this guidance, right, that was unbiased. It was from a team of people that a lot of times have healthcare backgrounds or counseling backgrounds. It's our advocacy team, and it was software driven because we realized that this 50 different enrollment periods, 2,000 different combinations. One person's not going to get it straight in their head. I couldn't get it straight after, I still have to look things up after 8.5 years. So we developed a software platform. It's like a TurboTax for Medicare called the Medicare Checkup. And it goes through somebody's specific situation, and it identifies enrollment period, identifies what options are right for them based on their specific lifestyle and medical needs, and projects out also what we think that they'll need in 5 to 10 years because we have enough data on that. And it's a really cool system that we developed that our team uses to help provide that level of guidance that, again, I wanted for my family and patients. And then for the employer, the benefit of that, so the patient gets a service, or the client gets a service from us for no cost on our platform, because a lot of times the employer is paying for it. So the employer is paying us as an employee benefit, because employers now concerning employers offer health insurance, they offer caregiver benefits, and then they're realizing that for their employees that are getting older and for the employees that are caregivers, there's a huge need, a gap that needs to be filled in terms of helping people navigate Medicare. And also the other financial benefit is that in cases where truly it's better for the employee to go on Medicare versus staying on their health insurance, the employer saves a lot of money. So we had one case where there was a 5,000 person company, and just recently, and they were self-insured, meaning that they were paying for their own claims. So big companies, what they can say is that, look, if we keep our employees healthier than the general public and we pay their own claims, then we can save money on health insurance. So that's what they did. And the first week we implemented, there was this was a big, it was a service industry, and it was a driver, and the driver had been there for 30 years. So a lot of loyalty to this organization. His wife had stage 4 ovarian cancer, and she's still doing well today, but she was getting her care done in a big city, big hospital system. About 1 million, 3 million foreign claims every single year for that one person. Not even the employee, just the spouse. Right. And of course the company was paying for it. And what ended up happening was we did the back and napkin analysis from a third party perspective and say, hey, look, you can save $2,600 by having your wife go on Medicare for you personally, based on deductibles and copays and her doctors and so forth. And for him, it was no brainer. So they saved $2,600, and the company saved $1.4 million a year, just off that one case. So the return on investment can be tremendously asymmetrical, and everybody's happy. Right? So that's the first step. So this is the value that we created in navigating people through the system, because I feel like I'm still learning, and whatever I want to learn, I want to then teach immediately to people. And so this is our first step, and that's what the company Doctor's Choice is that we provide that crystal clear guidance and advocacy, and we help people actually fill out the paperwork to transition them from employer coverage to Medicare. It's a win-win-win across the board. I guess in some cases, maybe we're offsetting the risk to the government. That's where people are like, where's the free lunch? Well, the free lunch is kind of like the government, which is we're all paying for it. But that's a bigger problem that we have to worry about. Exactly. But at least in the meantime, employers can save money legally because you can't push employees off. It's the employee's choice. And we want to make sure that we want to be that neutral third party where it's truly a better bet for the employees. And from there, we were able to now work with the insurance companies, understand how insurance truly works. And I realized, Chris, it's funny, when I was a medical student and when my colleagues were trying to get in touch with the insurance companies, right? You know how difficult everything was like, you get a claim denied and then you got to appeal it. And then Uh,
Yeah.
at the office I was in, we were spending $200,000 a year off of $1 million top line to just do all that stuff.
Hmm. Yeah.
That's something that we could either help give to charity care. It just
Yeah.
boggles my mind. But you can't get a call back from insurance companies, and
Yeah. Huge
I get
weight.
into the Medicare. Essentially, we're in distribution now. The part of the business model is we become their insurance agent, but everybody's salaried, so it's unbiased. But
Yeah.
when I'm sitting in that seat, I give a call, and the VP, the SVP, the president, the CEO, all these insurance companies, they call me back. I
Hmm.
can have a conversation. I can say, hey, look, we had one of the local plans. We gave them a lot of advice, and my passion in Eastern medicine. I said, look, we have a lot of clients who could benefit from acupuncture. This is back when Medicare didn't cover it. I mean, this year I think they did overall. And I said, look, we got to add a lot of these holistic medicine
Hmm.
components into these plans.
Wow.
And because of our volume and the amount of people we've helped, they did it. I was
Wow.
like,
Yeah.
when did you ever, as a physician, you could get a insurance company to move?
Almost never. It's like huge. I mean, it's like
Yeah,
you can't. It's like moving a mountain. You can. So it's
right.
just.
I was like, maybe we're onto something. So our purpose with the company is to truly help people live healthier lives.
Mhm.
And our short-term mission is how do we help 1 million people transition from their employer coverage to Medicare and beyond successfully?
Right.
And for people that are wanting to start companies and or are providers and physicians that are thinking about, I have this great idea, I want to execute on it. There's
Mhm.
no right way to do it, frankly. The process of going from a I guess a provider, I was a provider in training, definitely, and to an entrepreneur was a big move.
Mhm.
And I don't think you did it successfully.
Took a
And
lot
a
of
lot of people that
courage.
you've have on your podcast did it successfully.
Mhm.
And everybody in general has a different story, but I feel like the similarity is literally having faith. I don't this sound really corny, but I used to think it was all mechanics, right? It was about, all right, you got to write a business plan, you got to do this, you got to get these business cards, you got to do something.
Mhm.
And people that told me it was about building company culture, building, building. I shouldn't say because I think
Yeah.
that's condescending, but the building culture and a lot of the soft stuff, having faith and
Uh-huh.
taking that step. And I was like, dude, I'm just trying to survive here, right? I'm trying to pay my next month's bill because
Uh-huh.
I've decided to do this. Give me some mechanic. What can I do immediately? But now that I'm 8.5 years in and never took on any institutional money and
Yeah.
I've grown the company, even though we're not you know not close to even close to where I want to get to. But now having some experience, I realized I wish I just slow down and focus on starting small instead of
Uh-huh.
looking big. Right?
Yeah.
Because when you first start, like you got the suit on, or at least for me, it was like I wanted to seem like I was big because I was a one-man band.
Uh-huh.
I want people to take me seriously, especially as a provider, somebody that's new out of school, out of training. And I realized looking back that for folks that want to start,
Uh-huh.
there's no shame in being a one-man band because the people that are going to buy into like you seemingly big are the people that a lot of times want something from you that's more than what you're typically willing to give. And if you just start by looking like who can I help, what can I do immediately, everything's an exchange.
Mhm. Mhm.
Right? I was exchanging guidance for the ability, for either an employer to pay me or insurance company to pay me to do the guidance. And that was it. That's the fundamental. You have to look at what's the exchange. And if you're
Yeah.
helpful to somebody and you're helpful to a point where they'll pay you to do something because it's a big enough pain point,
Mhm.
then you figure something out. And then
Right.
you got to keep on doing it and you get very good at doing it. And then scaling up is then you have to get other people to do it. And that's where the culture comes in. You have to make sure that you have to hire people that fit into the mold of you want diversity, but you want also people that believe in what you believe in.
Right.
That's super hard to find.
Yeah.
Right. And that's why most entrepreneurs fail to scale up more than having really like a solopreneurship, which is just you owning your own job, which
Yeah.
is really, really stressful because a lot of times, and I've been there and I feel like I'm still there some days, where when you start a company, the first person you take advantage of is yourself. You underpay yourself and you
Mhm.
overwork yourself. And when you scale, when you first start to hire, you can't really hire a lot of top tier talent because you don't have the money unless
Right.
you go out and raise a bunch of money. Then who do you recruit and take advantage of? People that you care about, right? You have your spouse or you have your friend, come work for the business and you're really underpaying them and overworking them still.
Yeah.
And then from there, you sort of, and everybody goes to the same things. There's just very few stories out there that are different from there are a lot of different approaches that you can take, but in terms
Mhm.
of themes and in terms of, right, the superhero, there's 1,000 different scenarios that the superhero can be in, but ultimately the story is superhero goes through some type of transformation,
Mhm.
gets beaten up, transformation, finds him or herself, you know,
You're right.
overcomes the villain, and then the end, like
Yeah.
happily ever after, for the most part. And there's a sequel, and then try to make more money off of it. But then that's in entrepreneurship. I realize that they're the same themes, just much different scenarios.
Right.
So, those are some of the lessons that I've learned, which is, be okay with
Yeah. So do you
realizing
think,
where you are and seeing where you are and taking that first step.
yeah. So do you think, for example, the culture of medicine inhibits or promotes entrepreneurship? Because like our medical system really just pushes us. It's almost like it's like almost like assembly line. It's it pushes us into residency and then fellowship and then you attending and you work in hospitals and there's during medical school we never heard about investing or finances or starting a company. You mentioned venture capital. None of that. It was
Yeah.
just getting the residency, which is it doesn't make sense to me, but I just wanted to hear your thoughts.
But when you're residency, you're broke, right?
Yeah.
So
Exactly.
you're struggling to get by. I don't know how they can pay you under minimum. Like, anyways,
Yeah.
it's another story.
Yeah, I think that'll change in the future,
Hope so,
Yeah.
especially inflation really kicks in.
Yeah.
The So I think that, yeah, that it's a huge disservice because once you get out of residency, you start making, especially specialists,
Mhm.
your salary is still relatively high versus the rest of the population
Right.
of jobs out there.
Mhm.
But the problem, I hear this all the time, even real estate guys. It's like, what do you want to do? You want to find a fixer upper, right? You want to buy it at a
Look, discounted
you want to
price.
buy it at maybe like a 10 cap because the
Yeah.
place is still run down. Fix it up, force appreciation,
And then sell it.
sell it to a doctor for like a 5 cap.
Yeah, exactly.
And now we double your money or triple your money. You have
Yeah.
to sell it to the doctor. It's great. It's a no stress, passive income. You just put in your money, and what happens? The doctor comes in, they're like, this tenant's leaving. This tenant wasn't a long-term person. These things weren't properly fixed, and
Yeah. Yeah,
you're
exactly.
screwed financially. And that's not to say doctors aren't shrewd. I know a lot of doctors who are shrewd investors, but they had to learn it themselves.
Yeah.
I do agree. It took me to go into entrepreneurship. It took me about 3, maybe 5 years to unlearn medical school because I was living in a state of fear, right? Because
Yeah.
in medical school, even in residency, in some cases, a big chunk of your grade is whether or not somebody likes you.
Yeah, exactly. It's like
You can take a
75.
test, and once you get into clerkship, it's like, did Dr. Jones like you? And if she didn't, then you were screwed.
Yeah. It's 80% of your grade
It's
is
whether or not somebody likes you, which is,
which is
I get
nuts.
that in business, you need to
Yeah.
have relationships. That's really, really important. But you're delivering tangible value. Whether or not somebody likes you,
So very subjective.
excuse me, whether somebody likes you is irrelevant because it's if whether or not you can deliver value at scale to somebody. Because Chris, frankly, it's like if you can help me with something, and not saying you're probably one of the nicest guys I've ever met, but it's like if I'm like, Chris is an asshole, I'm still gonna, if you're the only guy that can provide me that service,
Mm,
who am I working with? I'm working with you.
exactly.
And you can ask whatever price you want. So that's the thing, is that once you get into sort of the real world, get into business or get into what, it doesn't matter if you're liked, you have to be really smart about uh what's the exchange. Are you providing something valuable? And if you're a nice person,
Uh-huh.
that means I'm going to continue to work with you if there's another option. But you got to first deliver the value, and then you're kind. Oftentimes, it's, yes, if you're not a nice person, if you're not well liked, then you end up, people are going to find the next best thing as quickly as they can.
Yeah.
So yeah, going back to your original comment about, does medicine, the medical training, allow you to think entrepreneurially? I don't think so. I don't think it does. And I know that there's some institutions that are trying to instill, like when I was at Brown, they allowed me to do essentially like an independent study, which was my opportunity to really investigate how to start a business.
Uh-huh.
But essentially I was paying tuition to do that, right? I was like paying tuition to kind of explore on my own. And then it's like, what's the real ROI? I was really self-directed. So, but it's about the people, right? I won't say that from a blanket perspective, the system doesn't allow you to be entrepreneurial, because you can find the people that are going to be really supportive, that say like, hey, Johnny, you can do it. Right? You're still young. Go out and do it. We'll do what we can to help you.
Yeah.
But the system as a whole, I don't think we're there. Individuals, absolutely. And so I had a few individuals that were, they said, one of them, he unfortunately passed away a few years ago. He started one of the largest physician groups, where we were in Rhode Island. And he said, look, you can do it. Just that looking back, I probably should have said, look, I don't need the approval.
Mm-hmm.
Being Asian, being all that, the whole thing,
Yeah.
it sticks with
Yeah,
you.
went through that.
Yeah. But then he was like, almost like I was looking for permission. That's what the medical system also forces you to become, is you need to ask for permission, because I get it. If you're in surgery, you don't follow the rules, you're entrepreneurial in surgery, you can kill somebody.
Yeah, the patient dies.
Yeah, but to drive forward innovation and to build something that's beyond yourself, instead of being an operator in the, I guess no pun intended, but being an operator in the medical system,
Yeah.
I don't think we do a very good job. We need to do a better job, but it's scary because, incentive-wise, the institutions don't want you to be entrepreneurial. They want the few guys to do something really big to help them, and put a couple $1 million back in their pot, a couple $100 million back in the pot. But if everybody does it, you'd have no, you have no providers.
Yeah, exactly.
Long, hard hours.
Yeah.
So there's sort of the incentives there as well. So at the end of the day, for me, it's not being a victim. And it's why it's so hard nowadays too, when you turn on anything, you read anything, unless you're focused on positivity, right? And you're focused on people who are successful. And same thing if you're looking at healthcare, I think healthcare is broken. Yes, it's important to study the mechanisms of everything, but why do we almost exclusively study sick people to get healthy? I don't want to study somebody that makes poor financial decisions to see how I can be financially successful, right? I want to study people who are wealthy that have done it and say, what did you do? What did all, 100,000 of you, is more, have done that made you successful? And every single one of them, it's like, okay, read these books, and like the top 5 books are like the same. You got to do Think and Grow Rich. You got to do, what's called the Rich Dad Babylon. You got to do Rich Dad Poor Dad. You can do a lot of the same books. It's usually the same set of books.
Exactly.
And so it's like, okay, well, if it worked for all these people in all these different scenarios, who do I take advice from? The guy who's saying, hey, Johnny, I'm struggling to pay rent, but you shouldn't do that because that's dumb and you never make it. Who do you think you are? Or the guy that says, look, I built a 10-figure business and I'm able to sponsor all these hospitals and help these millions. I'm able to travel in my community and around the world and help millions and millions of people. I'd rather be that guy.
Yeah,
and follow, get advice from that guy.
exactly.
So it's about fine. Yes, the system is messed up. The system is crazy, and it doesn't inspire entrepreneurship. But that doesn't mean that it's an excuse. If you truly got it inside of you to say this is what I want to do, then you got to have the faith to do it. What's that saying? What's that story where people it's like on your deathbed and you've got the dreams and all the ideas that you had that were never executed on, and the dreams are saying, look, we came to you because you had the gifts to
Mhm.
bring us into reality, and you didn't, because
Right.
you were afraid, because you felt like you wanted to fit in some box, because you wanted to be liked, because my friend Joey wasn't going to accept me if I went a certain route.
Right.
And you got to live with that regret, even for that millisecond before you transition to the next thing. Just the thought of that is just it's
Mhm.
painful, right?
Yeah.
And
Don't.
hopefully that's painful enough to do
Mhm.
something. And that was painful enough for me to do something about it.
Yeah. Yeah. Don't die with regret. It's better to take action and fail and learn than not take action and just, hold on to that and just, go, the pain of regret is worse than the pain of failure.
Yeah,
We don't understand that because everybody has time, but once you run out of time, then you realize that everybody's going towards the same path. It's just how you use that time and the decisions and actions that you take. So,
big
and
time.
yeah, and you mentioned the good thing, interesting, is everything is like our culture is fear based. Don't make mistakes. Don't, if you put the wrong answer on the test, you're rewarded for not making mistakes, rather than in business entrepreneurship, we're rewarded for taking risks, taking action, making mistakes, but we learn and we move forward. So, um, you've given so many great pearls, and if people
Oh,
wanted to,
broken record. It's all the same stuff that everybody else says, right? So it's like maybe you hear it enough to
yeah,
either reinforce it or take that leap.
yeah. I'm sure a lot of the listeners would be interested in connecting with you. So how would they find you on your website and your social media? And feel free to let listeners know. And I'll push.
Sure, I got to get better at social media. So if you want to follow us on Facebook, Doctor's Choice USA,
Mhm.
and then also on Twitter, Doctor's Choice U, and we're on LinkedIn.
Mhm.
We are currently restarting our YouTube channel. Maybe there's another conversation around why we're doing that. And then if you want to follow me personally, I think the most active, I don't know if it's going to be helpful to you. I go to Disney World and I take pictures of food
Mhm.
on Instagram. So it's just my full name, Johnny Z. Liu.
Johnny.
So there's no followers and you want me to post more other kind of stuff, I'm happy to do so.
Yeah. And
So, but I welcome you all, anybody to connect. Happy to see however I can help in terms of getting people off the ground, or if somebody's interested in the Medicare space, or if you're an employer interested in
mhm.
putting this service in for your employees, more than happy to chat.
Yeah. And for all the listeners, we'll put all of Dr. Johnny Luo's information and references in the show notes. So thanks so much. You've dropped so many tons of words of advice, wisdom. Your story is so inspirational, and you've given so many examples. So take care, and we hope to hear about your progress in the future.
Chris, thank you. Thank you. I'm following your success as well.
Thanks so much.